Hey guys, Don here. Welcome to Podiatry Practice Mastery, going over kind of what helped get to the $1 million mark and beyond. So we are on day number 9 of our medical record transition. So it's getting a little bit better. So a few things that have kind of helped with the morale. I've been kind of joking around with the staff today. It's working a little bit better. I think we're feeling a little bit better about the whole transition. I got out of the office at 5 p.m. versus the other days was a lot later. I'm learning more how to get the level of office visit that I want, which I'm typical, which are usually level 3s and level 4s. Did a lot of EPAT, was able to have Morali get used to the new system. We're training the new staff, so everything is kind of doing better. I'm getting help with ModMed for our training to make routine care, so I was able to fix my notes for routine care. So I actually was able to write down what I did today, so that's a good sign. So I'm finally able to actually document what I'm doing a little bit more to help. So what I did here, but my new schedule doesn't have the number of patients, so I don't want to count them, but there's, I don't know, a normal amount you'll see as I go through here. So the first patient was bilateral cariflex, so they got 2 nails done. And so I did that. Next was a patient with some blisters, so just a level 3 office visit with some blisters. Next patient was a 6 shockwave 12-week follow-up. He's doing much better. He doesn't need any more shockwave. He's doing fine. He's back to doing his races, and really pleased with the Achilles tendon. Next patient was number 1 of 3 for some pain to the tibialis anterior of shockwave. Kind of has pain in that area, kind of like shin splints. Also had some equinus, so we put them in a night splint as well with an office visit. Next was a follow-up of balance braces. They just needed some help, kind of how to put them in the shoes and things like that. So I helped them just with an office visit with that. Next was a patient that had a prominent first met cuneiform joint. Get an x-ray. Patient needs, it's so large, just has a hard time fitting in shoes, so she needs a surgical procedure, so I referred her over to Matt for that. Next was a number 4 out of 6 for a 5th met. This was that osteotomy patient that had a MIS osteotomy that's kind of slow to heal. So number 4 out of 6 for just focus shockwave only. And she is doing better, feeling better. She's like a real kind of semi-professional water skier. Next patient was number 1 of 3 of shockwave for plantar fasciitis. This was actually 1 of 6. This was a patient. She's actually a primary care doctor. So I did the whole explanation for her, and she had a good result with one of her patients that got shockwave, and so she came to see me for shockwave. So that's always a pleasure when it's another, she's a PCP that refers to us. And so we're going to set up those shockwaves for her. And then next one was a self-pay patient. Oh, this was a patient that came back. She was a friend of mine from church, and she was seen for plantar fasciitis, didn't want to do anything, and came in for a cortisone injection, so we did that. Next was this patient, I don't know, we all kind of have these. She's a 55-year-old that messages me multiple times, emails multiple times, and just has some kind of, like, she had heel fissures, and I'm not really sure what's going on. I think it's more maybe kind of a challenging just patient type, more so than anything. She's very insistent and has seen multiple other opinions, and so I really said I couldn't do much for her, but just spent time listening to her. Next patient was a 55-year-old man that was here for, he had some forefoot pain, and he had bone marrow edema on his MRI that I reviewed with him, and kind of bone marrow edema. And for him, what we're going to do is shockwave for that to kind of help with that, to kind of get down the bone marrow edema for him. Okay. Next one was a 9-year-old. I had 2 Sievers kids. This was one that had Sievers. Kind of did my typical protocol for Sievers for them, and if it doesn't get better, we'll do shockwave. Once again, shockwave is safe for Sievers, but I'm hoping we won't have to do that. I usually use the Thule heel cups. This one already has orthotics, so I did this for this patient. And next patient was another patient, got X-rays, had plantar fasciitis on the left. Spent kind of a lot of time. She had a lot of other things going on with this one, and this one I did, I think for this one I did a cortisone injection for her. And then the other two, there's a daughter and mother that came in for calluses. So I did their calluses for them. They were both self-pay. And next was number 4 out of 6 shockwave for a 33-year-old. Next one was a 6 out of 6 for shockwave with a level 3 visit because it was the last one. So it was a busy day with shockwave at the office. Patients are getting better. I had 2 Seavers patients. There might be another one that I'm missing. And this guy, kind of the more challenging one, was this gentleman with that needed the shockwave for like the bone marrow edema, kind of MRI changes in the area. So I find that bone marrow edema works okay. Actually, this guy, I'm sorry, just remembering here, he actually had a sesamoid, the fibular sesamoid. He had bone marrow edema in there, and so that's where we're doing the shockwave on that. So it's kind of a better option than cortisone, better option, I think, than surgically removing it. Okay, so that was the day. Once again, things are getting better. I'm still doing my positive focus. So today, when I'm recording this, I'm on day number 10. Morale is doing better. Everything is kind of getting better. I think this is a good idea. So if you guys are going through big changes, I just have this piece of paper. It has 10 things, and I write 10 good things each day. I think it helps my mental health during this transition. Okay, have a great one. Hope this was helpful.